Planning your medical career. This session is primarily aimed at foundation doctors who are in the early stages of career planning and looking ahead to what they will do after Foundation Year 2. It would also be useful for postgraduate trainees who are uncertain about their career. There are Foundation Careers Advisors for each area who can help you, and the Associate Postgraduate Dean for Careers can also be contacted for cases where in-depth counselling and guidance is needed. The learning outcomes of this session are to understand a range of career options open to you after foundation training, to be more familiar with the career pathways through specialty training, to recognise the importance of early planning and how to adopt a 4-stage approach, and to be able to access a range of career information resources and know where to go for help. As a first port of call, you can talk to your educational supervisor. Staff in the Postgraduate Centre are also helpful, especially for questions about your e-portfolio or for finding out who to ask about things. They can arrange an appointment with the postgraduate clinical tutor, and if your question is more complex, you can contact the Foundation Medical Careers Advisor for your area. Royal College tutors are also a good source of information about their specialties. Ultimately, whatever route or level of career support you may access, your career choices and decisions belong to you. Nobody can make the decision for you, and it is important that you make your own decisions. Your career, at its simplest, is that you go to medical school, then become a junior doctor, enter specialty training, and become a consultant or a GP. However, medical career pathways are far from straightforward. There are many possible entry and exit points from specialty training. It is important to realise that your career pathway may not be as straightforward as you would like it to be. There will be choices and decisions for you to make, risks to consider, and alternatives to explore at every stage. There are 3 different types of specialty training open to you. In some specialties you will do core training, that is years 1 and 2, and these specialties include medicine and surgery. And at the end of your 2 years, you will have a competitive interview, and if successful, you will enter SD3 in a branch of that specialty. The second option is to choose a specialty where there is run-through training, and this means that if you enter at ST1, providing your annual assessments are satisfactory, there is no further competitive interview, and you will be able to stay in that specialty until completion and getting your certificate of completion of training. The third option is broad-based training, which is a 2-year programme consisting of 4 different specialties, which are psychiatry, general practice, core medical training and paediatrics. At the start of the 2nd year, you will be given the option of choosing one of these specialties for further training. And out of the 2-year programme, you will be given a year towards the specialty you have chosen, and therefore enter that specialty at SD2 or CT2 level. There are alternative options other than entering a training programme after Foundation Year 2, and these include being a clinical fellow or trust grade doctor, a locum for service known as LAS, having a year abroad, and also exploring a different healthcare system. You can decide to undertake non-clinical work such as research, teaching, or using your medical degree and training for another area such as law. Here is a breakdown of which specialties are uncoupled. These are 2 years in core training, except for psychiatry, which is 3 years, as is the Acute Care Common STEM, abbreviated as ACCS, and consists of anaesthetics, emergency medicine, and acute medicine. It is important to be clear which training programmes are which, as you may like the job security of a run-through training programme. Finding out the difference between coupled and uncoupled specialties could be a factor in your decision making. A helpful book when planning your career is called The Roads to Success. You should be given a copy of this book at the start of your Foundation Year 1 post. The book guides you through 4 stages of career planning, which are self-assessment, career exploration, decision-making, and plan implementation. To help you with starting your self-assessment, all Foundation trainees in Health Education West Midlands should attend a Windmills Career Workshop. These are available to book via our website. Important career anchors for you to consider are whether your chosen specialty is available in all of the local education and training board areas. The Roads book has a number of exercises which will assist you with your career planning. Self-assessment tools includes Sci59, which is an online tool giving you a ranked list of 59 specialties, which was the number available at the time the tool was set up. It is important to realise what lies behind the ranking of the specialties, and not to take the list as the order in which you will apply for a specialty. It may be that you are more suited to the number 15 choice on the list, rather than the number 1 choice. Sci59 is a useful guide if a careers advisor helps you to analyse it. We strongly advise against using this tool on your own. Sci59 passwords are available from the Foundation Careers Advisor for your area. Other self-assessment tools are available on the Medical Careers website, www.medicalcareers.nhs.uk, and this has free generic tools and a lot of useful information. When you move to the exploration stage of the Roads model, it is important to start with all the specialties that interest you and then narrow them down. Avoid making a choice too soon and therefore not considering all possible options. We talk about having a plan A, which is your first choice of specialty, but it is also important to have a plan B, which is your second choice, and something you could do and be happy undertaking and pursuing as a career. If you are unsure about specialty choice, then we advise undertaking a taster session in either one specialty or a couple of specialties. Plan plenty of time to make your career choice. We suggest that you undertake a taster session in either the second or third post of Foundation Year 1. This will need careful planning with the Foundation Year 1 posts that you will be in, and also with the postgraduate clinical tutor. If you decide that the specialty you have had a taster in is not for you, then after discussion with the postgraduate clinical tutor, it is usually possible to have a second taster week in your first post in Foundation Year 2. At the annual Health Education West Midlands Careers Fair, there will be consultants from many specialties present, as well as trainees. You may find it useful to talk to the consultants for their perspective, but also to talk to the trainees who are currently undertaking specialty training programmes. It is important to be aware of information about specialties, which will help you choose your career. It is helpful to look at the person specification and competencies required for the specialty well in advance. These are usually available around the time of national recruitment, with application in round 1 being in November or December each year. If you are in your Foundation Year 1 year, then download the specifications, as the ones when you apply in F2 will be very similar. This will help you to develop the required competencies, which will increase your chance of getting a specialty training post of your choice. There are some useful websites, both regional and national, giving careers information. Royal College websites also have a lot of information on specialty training. The West Midlands Deanery website has specialty podcasts, which give a useful insight into what it is like to work in the different specialties. The UK Medical Careers website is the most important resource. It has something for everyone at every stage of their career. You can create a profile and try out various career assessment tools. Specialties can be explored in detail. You can explore other career options relevant to medical graduates, such as working abroad or practicing outside the NHS. At every point, there will be links or you'll be signposted to other external information sources. We recommend you bookmark and use this site, as it should be your first port of call. If you would like to discuss your career further, one of the Foundation Careers Advisors can be contacted. Here are the details of the Foundation Careers Advisors and for Dr. Goodyear, Associate Dean for Careers. So in summary, draw up your action plan from the following next steps. Find out who is your Foundation Programme Director and Foundation Careers Advisor. For self-assessment, book on a Windmills workshop. Try Sci59 or other profiling tools. Get your curriculum vitae and e-portfolio ready for specialty application. Go to careers fairs and events. Research and explore specialties of interest. Think ahead to possible tasters. Build up your e-portfolio, including careers reflections, and bookmark sources of information. The earlier you start thinking ahead about your career, the better. Good luck.